a family practitioner and medical director, primary health at Henry Ford Health and Henry Ford Jackson, Dr. David Kolde. Welcome back.
Thank you. Glad to be here.
Great to see you. And today we wanted to talk about a couple of things, but one, and something that during the pandemic kind of went to the back burner in people's minds, and that's our addiction issues, drug abuse, opioid addiction. Did it get worse or any changes during the pandemic?
Yeah, unfortunately, the pandemic, things got much worse.
Really?
Yeah, we had, people didn't have the ability to go out and do as many things. People weren't at work. Isolation is something that drives addiction. So yeah, unfortunately, things did get worse.
Yeah, so there were people that did suffer during the pandemic, job loss, loss of income, they lost friends and family members, and that all contributed to the abuse of drugs.
Yeah. Locally, statistics, we had like 55 people pass away from September 21 to August 22, kind of as we were kind of starting to come out of it. We have anywhere around 578 overdose visits to the emergency department per year. So it's, the drug problem is unfortunately still quite prevalent.
Yeah, I look at the police blotter every day, and there's always 2 or 3 where police respond to an unresponsive citizen, and that's basically they're overdosing.
Yep. Yeah, so it's something that we're trying to, figure out ways to support these folks in the community and, figure a way to help fight this.
We do. We have the hospital. We have you. We have several organizations that all participate in some form. And there's an initiative, I understand, that is underway called In Our Backyard.
Yeah.
What's that?
A few weeks ago, Home a New Vision and Drug Free Jackson put on an event at the Martin Luther King Center, Recovery in Our Backyard. It was where a lot of the resources for people that have addiction could come and get information. Henry Ford was there, our adult recovery center, our addiction recovery center was there. I was there. It was great. They had testimonials by folks that have kind of started their journey, in all stages and phases, and it was food, and it was a good time.
The other day, I was at Andy's place, and they gave me a box of Narcan, and I said, "Well, thank you, but I can't see using it. I don't know where I would use it." And she said, "Well, in the last month, she used it 4 times." And I said, "Okay, well, yeah, but I'm not, and she said, "It was at Walmart 3 of the times, and on the side of the road the other time."
Wow, yeah. Narcan is a medication that can be administered to folks that have overdosed. It helps reverse the effect of the opiate, which usually it's them stopping breathing. And it's a temporary thing. Once they reverse it, though, they still need to go get help because that Narcan doesn't last all that long before they might slip back. So usually need to administer multiple doses.
Are there people that, I don't know what, maybe the thought process might be, that say to themselves, well, my boyfriend has Narcan in the car, so I guess, if something the worst happens, at least somebody's going to save me.
You would hope, but unfortunately not everybody's always aware where it is in the car, and even how to use it. People probably should learn how to administer it. It's either a nasal spray typically or a shot.
So besides the person that is using or abusing the drugs, who else in the community is impacted by drug addiction?
Yeah, so I think the average citizen thinks that it's somebody else's problem. I mean, obviously it's the person that's addicted, the family and friends, but anybody that pays taxes is addicted. Folks that have addiction Unfortunately, you have to utilize services, emergency services, if they're overdosing. We have a number of very functional adults that are addicted, that either have to take time off work to get their medication, or risk behaviors to procure money to get it. So it's something that affects everybody in some way, shape, or form. I would say that most people know somebody, whether they realize it or not, that has an addiction of some sort.
I know families, one of the issues that bother families with someone in their family with the problem is the stigma that the person's a bad person.
Yeah.
And that's not...
It's just not true. Science, we've done research now that we know that it's not just a bad choice. It's more than that. There are neural pathways that are changed. There's a predilection to addiction. You can be addicted to a lot of things. Opiates is one of them that can have catastrophic consequences. But it does change your brain. And so then it becomes not just a choice. It's a lot harder to make good decisions when you have an addiction. So I think we're debunking it, much like obesity. People just thought, they just eat too much. And that's not necessarily the case.
Yeah, so whatever someone's battling, whether it's, as you say, obesity or some other addiction, smoking, there are people that are wired more susceptible to addiction than others.
Absolutely. Your telephone. How many times do we see our teenagers, it's not, we are addicted to a lot of things.
So the resources that are available, they're from a variety of sources. How does someone find, when they need help, where to go?
Yeah, so I've been here about 4 years now, and it's really starting to see a coming together of resources and a more coordinated effort. So there has been a group of us that, Alan Lazara is an ER physician. He's been on the show with me and Brooke Cross, who's out of Home and New Vision. So there's different entry points into getting help. The emergency room is a simple one that everybody knows. You can get to the emergency room. It's not going to cost you anything, really. And you can get started. The Home and New Vision, you can call Henry Ford. Everybody knows how to get a hold of me there. The Center for Family Health also is involved in this coordinated effort. Drug Free Jackson has a wealth of support services and information for people. And then I really partner with the Home New Vision mostly.
Do people, I see also on the police blotter that people, they refuse, they refuse transport to the hospital after they maybe been revived from an overdose. What's the fear of going to the hospital if you've got that happening to you?
I think a couple of things. One, stigma. I think folks that have addiction feel like people look at them a certain way, unfairly, but I do think that occurs. I do think there's probably some legal concerns and fears that people have as well. If you take me in and I was, overdosed, I'm going to get in trouble with the law or something like that.
Yeah, so maybe they're doing something illegally, they've obtained drugs illegally. You're not calling the cops when you're treating an overdose victim at the hospital.
No. We want to get them help. Everybody's got a story. I have yet to, I've been doing this now probably close to a dozen years as far as addiction medicine, and I have yet to meet a patient that sits in the chair across from me and wants to be there, right? And no one ever woke up and said, I want to be an addict. So everybody has a story, and I think it's incumbent upon us to listen to the story and not have this blanket idea that all addicts, are making that decision to be that way, and so I think we need to have a little more empathy for them.
And there's some, I guess, success that folks like you and Home of Nuvention and Drug Free Jackson, there's positive results.
Absolutely. It's actually the favorite part of my practice, because when you do see people get control of their life back from a substance, it's really gratifying. And so you get a few of these success stories, and it kind of hooks you, to want to help. I think my most striking success story was parents brought in their 21-year-old son who was at rock bottom. He had been homeless. They found him. He agreed to at least go back home. He was, 6'2", 120 pounds, just a skeleton. And just really sat there and didn't say a whole lot. I tried to listen to the parents, who were, both crying, and I told them what I could do, what I could offer. He didn't say a whole lot, gave him the prescription. They left. I wasn't sure I would ever see him again. Did some follow-up, and long story short, in 2 months, he put on like 60 pounds, just a completely different person, and remained drug-free, got a job, mended a lot of relationships. And so that's what can happen. People can get their life back.
What got you into addiction medicine and treatment?
The need for it. I had a partner, I was in Washington State, and drug problem is everywhere, and we had a lot of fentanyl in our town, and I had a partner that was addiction certified, board certified, and he was looking for people to help him prescribe Suboxone, which used to have a special DEA license to be able to prescribe it. And so I went through the training and got it. And then, you start having those kind of success stories, and that's what got me. The good news is now, as a physician or an advanced practice provider, like a nurse practitioner or an APP, you don't need that special license anymore. The DEA dropped that requirement at the end of 22. So now anybody that's got a DEA license can prescribe it.
And we have fentanyl in our community.
We absolutely do.
We appreciate the work that you do for our community members, and we appreciate you taking time to be here today.
Thank you.
From Henry Ford Health and Henry Ford Jackson, Medical Director, Primary Health and Family Practitioner, Dr. David Kolde.